Good morning, good afternoon, everyone. My name is Victoria. I am here with Pamela representing Pharmacists Without Borders, or PSF Canada. I am a first year undergraduate student at the University of Toronto in the pharmacy program, the Doctor of Pharmacy. And Pamela, if you'd like to introduce yourself.
So my name is Pamela. I am a pharmacy manager in Toronto, and I'm also one of the webinar leads, like Victoria mentioned. And should we pass this on to Linda? Would you like to introduce yourself?
Hi, my name is Linda Dresser. I'm an assistant professor at the Faculty of Pharmacy in Toronto, and I am a member of PSF and the mission lead for a project in Ghana. It's something that I've been a partner with for a number of years, and we'll talk more about that as we get into talking about the mission itself. But my background is as a hospital pharmacist in infectious diseases and antimicrobial stewardship. And now I'm kind of semi-retired, which gives me more time to dedicate to this project.
And Amanda, would you like to introduce yourself as well?
Okay, so hi everyone. My name is Amanda Aryee. I am a pharmacist in Ghana. I've been practicing for about a decade, specialty mainly in hospital pharmacy. And I'm happy to be on this webinar with you. I've been working with Linda for some time, and I'm sure as we go along, we'll talk more about the work we've done together. Thank you.
Go ahead. Yes, thank you both so much for being here. I know you're very, very busy, I'm sure. So we really appreciate you taking the time out of your day to be here. To begin, we just wanted to go over the project really in a broader sense for viewers who may not have heard about the work you're doing. Can you tell us a little bit more about the mission? What are the goals here? What have you done so far? Maybe some highlights, your favorite points. Linda, if you'd like to begin.
So I'm going to go back in time and I'm going to talk about before this became a PSF mission and before we became a hospital. So the project really started in 2007 when the first mission came to this part of Ghana and started running mobile medical clinics. And from 2007 to 2019, we came on an annual basis and we provided 2-week medical mobile clinics. And about 2015 is when the hospital started to really become a tangible goal. And the leadership did a number of feasibility studies and started fundraising and starting to plan for this model hospital here in the northern part of Ghana. So that's the background, is that this is a transition. So this is a group that started working with communities, saw the need for a hospital, and then transition that vision to an actual hospital to serve the local area. When we came for our final mobile clinic mission in 2019, the foundations for the hospital had already been built, and we were able to walk through the hospital and actually stand in what was going to be the future pharmacy department. It was so incredible to know that this vision, this sort of vision of this team was going to come to fruition. And then it was 2021, and Amanda, you can correct me if I'm wrong, but I think it was 2021 when Amanda and I were first introduced virtually, because as members of the Ghana Health team, a number of us transitioned to become Ghana Health partners. And so leads from the different parts of the hospital, so lead nurses, lead physicians, we were all asked if we wanted to continue to work with the organization and to now partner with our colleagues in the hospital. So Amanda and I met virtually in 2021 and started to work on planning for the hospital pharmacy. And it's been a beautiful partnership. We've worked really hard together. And we started off with just, Amanda, her first trip here to where we are now, the pharmacy still didn't have any walls. She didn't know what she was walking into. I think she was a little bit like, oh, what have I done? But we talked about outpatients and inpatients, and we focused a lot on developing those foundational policies and procedures on hospital pharmacy, and not just for the pharmacy itself, but we worked on policies and procedures for the whole hospital. We talked about formulary. We were planning for the formulary, and we were able to work together on their electronic medical record. Believe it or not, this hospital is attempting to be completely paperless, and it has a web-based electronic medical record. So I'm going to turn it over at this point and let Amanda talk a little bit more about that first partnership and what we did with this project to create that relationship. us as the Canadian and UK partners and how we're serving this hospital.
Okay, thank you, Linda. And as I mentioned, it's a privilege to be here with all of you once again. So as Linda mentioned, the partnership started virtually in 2021. That is mainly for the pharmacy side. But aside that, as the years went by, it was extended to other units within the hospital. So as she mentioned, the Ghana Health Partners come and visit us, but this time the primary goal is not to have mobile clinics all over and actually attend to patients, but to train, to mentor, and in some cases, provide services so that we can actually see and learn from them. So now we have partners in the respective, I would say, branches or areas of the hospital, not only the pharmacy. And we're able to communicate virtually even when they are not here. So as of now, Ghanaians run the hospital full-time, and we get virtual support in terms of knowledge building, mentorship, and some trainings as well from the Ghana Health Partners, both in Canada and UK. So briefly, that is how we've set it up for now. So it's Ghanaian-based. All the health professionals here are Ghanaians, but we get support from our partners as well. So Linda, if I left anything out, just let me know.
No, and I think one of the things that Amanda alluded to there that's been really fortunate for us in particular is that we were connected early, and we've been able to work together specifically in the pharmacy domain from before the hospital was built. And so the foundation for pharmacy and pharmacy practice and this partnership is perhaps ahead of some of the other partnerships within the hospital, because we're able to get going early and to work on some of those important policies and talk about even, you know, how does Amanda envision staffing the pharmacy? We went through some models on that. We talked about a number of things that really helped, I think, when the hospital doors finally opened.
That does sound really incredible to have a paperless system.
Yeah.
Wow. Some of the hospitals here don't have a paperless system.
That links really well, actually, to one of the other questions we had about sustainability in the community. You know, that's great to hear. You know, locals are running this hospital independently, and they have access to support regularly whenever they might need it, and that's so brilliant to hear. And it's a really collaborative team effort. So that's amazing, and it must have taken a lot of time to set up, but it seems like, you know, both of you are really passionate and excited and happy to be there. So it's really cool to see you, you know, so smiling, and like it's a really successful project. So it's very cool.
So you guys already touched on this a little bit. Linda, you had mentioned that there was kind of like a need in like that Ghana community. Do you want to touch more a bit about like why Ghana and why that specific community? What needs did you see that kind of, I guess, led to you guys building this hospital?
So Amanda, do you want to start with a little bit of the local context in terms of the size of the communication in the community that this hospital now serves, and how this is making a difference to the community to have access to a hospital here where it didn't before? How far would people have to go? That sort of information. You probably have better pulse on the numbers now than I do.
Okay, so I'll just give a brief overview. So where the community is located, it's a bit rural, and as a result of that, it's a little difficult for the inhabitants to get access to quality health care. So I would say that within this area, the nearest major secondary to tertiary facility for a hospital, we have going, I would say, south, we have about 2-hour drive before you can get to any facility like that. And then going north, it's almost a 3-hour drive. And so anybody within that enclave, if you have any medical condition that the smaller health centers or CHIPS compounds cannot manage, you'd have to find means of transporting yourself across either north or south to get access to healthcare. So the founder had a passion for this, and he believed that everyone deserves quality health care, irrespective of where you're located and irrespective of the economic situation you find yourself in. This is a farming community, and so you have lots of low to middle income people living within this area where the work they usually do is farming. So they don't have lots of money coming in to give them the ability to move up and down easily. And then because of the nature of some of the roads, it makes transportation relatively difficult within this area as well. So he thought of putting the hospital in a central location where people coming from the north and the south, and then the communities surrounding that perimeter can actually have access to quality health care. And it's not just enough to have a primary facility, but if you are able to get basic things like diagnostic imaging, lab work done within this area, it's just awesome because you don't have to travel so far to get it, you know. So I think that was one of the main visions that drove all of this and led to the setup of the hospital within this location. So as of now, I think that we are providing healthcare to quite a number of people, smaller communities, I think between 150 to 160 smaller communities, aside the larger ones, which are, as I said, an hour south and then 3 hours north, all within this enclave as well. Yeah.
Wow.
So yeah. So I think that these are one of the things that really drove my passion to actually come and work here, because I felt that it's not just enough to be close enough to some of the basic things in healthcare when you are down south of Ghana, but when you are within the rural setup, it's good to just know that when you get a snake bite, there's a hospital that can just give you a vaccine quickly and you're fine. You don't have to travel an hour away. Or if you have somebody in labor, you don't have to struggle to get them across on a rough road to actually get access to healthcare. If you have a very sick child with a very high temperature, you don't have to go too far to get the quality healthcare you need. So I'm really happy to be working in this area and to have an opportunity to work with lovely partners like Linda, who have had some experience in this area because of the mobile clinics. Yeah, and they're tapping into that as well.
Yeah, I think that's really an important part of this partnership is that we've been here for so many years before this opened, that we know the communities, we know the area, we know what to expect, and we're more informed so that when this partnership transitioned into a hospital, we have the right context and expectations. We have the right sort of vision for what the hospital ideally will provide. I think that's a big bonus.
What would you say a pharmacist's role is in this? You know, you're talking a lot about incredible healthcare. You know, at least from my limited experience in my one semester so far of pharmacy education, I didn't really know how much pharmacists could do and how much knowledge we have. It's pretty phenomenal. So within this incredible collaborative care network that you formed, you know, what are the unique aspects of your roles as pharmacists that have contributed to the team? And maybe you could speak a bit on that.
So Amanda knows that I'm pretty passionate about the role that pharmacists have within our medical team beforehand and now, and that we are a cog that with us, other things don't happen. So without a strong pharmacy, surgeries don't happen. Without a strong pharmacy, maternity wards don't run well. Without a strong pharmacy, outpatients aren't going to get the care that they could get, you know, even though they saw a health practitioner and had appropriate prescriptions written. Without pharmacy, you don't have that final step. Without pharmacy, the inpatient. So the pharmacy role here, both for inpatients and outpatients, is I think it's very central to the successful operation of the entire hospital. Here, just like it is back home and anywhere, that, you know, drugs are quality drugs and right drugs are so important, and we've got a great team here to focus on those parts of it that help drive how well all these other things are happening, like how successful the maternity ward is and delivering and safely delivering babies. We're also supporting an eye clinic here and a dental clinic. Like it's a big piece, and it is very collaborative, and we're building, I think, on that. Like this time when we were here, Amanda and I has spent a lot of time, another pharmacy colleague from here and one from home. We've launched an antimicrobial stewardship initiative. So it's like pharmacy is integral, and this hospital has been built with the kind of a flattened hierarchy so that all of the sectors are working very closely together so that the physicians, the physician assistants, the nurses, the pharmacists, the OR attendants, like they all rely on each other, and they know how to lean on each other to provide patient care. Amanda, did you want to add anything?
Okay, so just to add to that, I would say that as part of the role, we don't only serve the medication, but we play a key role in procuring the medication. We are the technical experts when it comes to that, and so we provide key inputs when we have to buy medications from the right people, just to ensure that we get the right quality of medication and the required standards for the transport of the medication actually adhered to, so that the drugs end up at our remote area. It should be secured, it should be safe, it should be still having the high quality that we started with. And then we ensure that we keep that safely in the right storage areas, even within the different areas of the hospital, so that the integrity of the medication is not affected when it eventually gets to the patient. Yeah, I know that in some areas of Ghana, we have varying temperatures. So we have the highs and the lows, the cools and all of that. So we are mindful of all of that when it comes to our storage processes, just to ensure that the integrity of the medication is maintained when it gets to the end user eventually. So that's all I wanted to add.
Thank you. Sorry, Pam, I probably should let you ask a question. I was just going to add that I didn't even consider, transporting medications in, such a variable and warm climate. I didn't even consider that. That's just somewhere rural is challenging in any climate, but in a warmer one, for sure, challenges. Sorry, Pam.
And I was thinking too about procurement of medications. Is it difficult to transport or to be able to get medications into Ghana, since it's a more rural area?
I'd say that there's a collaboration with the hospital that I work with, and then a larger stakeholder when it comes to the healthcare or the Ministry of Health in Ghana. And they have provided a very good platform that gives us the opportunity to channel lots of quality suppliers within the same electronic platform. And so it's a collaboration between us and them. And the aim is to actually help the hospitals in the rural areas get access to quality medication. So once you join this platform, you have access to over 50 pharmaceutical companies and suppliers. And they have a variety of drugs within this platform. You get the opportunity to place an order electronically. They are able to send the order to the respective companies, and the companies are responsible for delivering the orders to you. Wow. So that really cuts out a lot of the stress when it comes to the purchasing of medication. And this is a really good initiative that we've actually joined, and it's really helping us get medications here within a suitable time. Just that you have to be mindful of the fact that because you are further away from the urban areas, you have to place your orders in time and make sure you have enough of a buffer, just in case they have transportation challenges on the end of the supplier, just so that you don't run out of stock too often. But that actually gives us the opportunity to have access to regular quality medication. And because it's an initiative that is linked to the government of Ghana and the Ministry of Health, they actually do have quality audits, just to make sure that the drugs that are getting to us are of the right standard, because they went through a process to screen suppliers and get them admitted onto the system, just to ensure that there's continuity in the quality of the medication as well. So we have logged onto that platform, and it gives us the opportunity to really get good medications within this area at an affordable price. Once the suppliers are on it, they actually get a larger scope to supply to, and so the prices are really subsidized for us. And this helps because most of our clientele base are on the National Health Insurance Scheme. This allows you to just pay a small fee annually and get access to free health care within the hospital anytime you fall sick within your area. And so we're able to actually meet this need without running at a loss, just because the medications have been subsidized to suit us here. So basically that's what we do. Any other thing that we're not able to source from this platform, we have specific reputable companies that have been in Ghana for years. And so once you contact them, they can actually have the opportunity to supply to you as well. Where we find ourselves, it's though remote, we are close to some of the regional capitals. So once you can get a link there and be able to supply, we still get the medications in good time. We just have to consider our lead time every time we are ordering, just so that we can manage our stock levels. Yeah.
Yeah. That's really great to hear. Pardon my ignorance, I wasn't aware of the brilliant health insurance plan in Ghana. That's great to hear. I'm a huge advocate for public health, and being from Ontario, that's a challenge right now. So I'm definitely, trying to fight the good fight. And drugs are often not covered by these plans. So you mentioned healthcare is, which is incredible. Are people paying out of pocket for medications? Have you run into any sort of issues with community members not being able to pay?
Yeah, so we have a variety of clients. Some actually have the health insurance scheme, and so they're able to access the free side of the healthcare, but some don't. So if you don't have it, but you still need the healthcare, you would have to pay out of pocket for it. So we've been encouraging people, because it costs a small fee to get onto the health insurance scheme. And sometimes people forget to renew the health insurance. It's an annual subscription. So even if you've done it before, but you don't renew it and you fall sick within that period and it's expired, you don't get access to the healthcare. Unfortunately, you would have to pay for it at that point in time. So we're trying as much as possible to educate the community that even if you're not ill, just make sure that you have an updated one, because you may never know when you actually fall sick and need it. So we've had some pay out of pocket just because of these reasons, because they're either not on it, they've not renewed, or they don't have too much knowledge on it. We take the opportunity to educate them as well.
And are medications included in that plan, or is it just physician and nursing services? Like
So
would your
medications
pharmacy
are
service?
included. Yeah.
That's
Sorry,
fantastic to hear.
medications are
That's
included in
great.
that plan. Yeah, they're
Wow,
included in that
fantastic.
plan as well. And they've actually taken into consideration the common illnesses that we have over the year, seasonal changes and all of that in Ghana. And so irrespective of how ill you are, there's a high probability that you can actually get to see a physician, do some labs, and then get your medication as well without paying for any of them.
Wow, that's great.
That's
That's
incredible.
incredible.
Yeah.
So much more accessible for people. That's really good to hear. Thank you for sharing, Amanda. Appreciate it.
Yeah. Such great initiatives in Ghana. I had no idea there were so many great initiatives to provide accessibility for patients there as well.
Well, we were chatting about the long-term goals for the project and setting up communities for independent success, which was definitely touched on. I don't know if there's anything you'd like to add, but
is there anything you guys would like to add?
So I think the sustainability is really important to the leadership of Liada, and Amanda will expand what I start with. Like, nothing this organization does is done without a view to the sustainability. So this hospital is just one of many initiatives that the organization controls, participates in, and they're all been successful. They've all been nationally and internationally recognized for how well they've been implemented and their sustainability. So this hospital wouldn't start without a vision to its sustainability. And, part of that original vision was that it wasn't going to be a hospital built and run by expats. It is going to be a locally built hospital, a locally run hospital that we will work alongside our Ghanaian partners, and we will raise them up. But they are they're the core, they're the ones that are providing the service day in, day out, and we come alongside and assist in whatever way we do. The paperless part of it is one part of the vision of sustainability. We don't need to think more about the carbon footprint that we're all leaving and contributing to. So that's part of it. They've also have some other initiatives that they created when they built the hospital that provide sustainability. And I don't know, Amanda, if you want to speak about the reverse osmosis, or oxygen, or other parts that provide income to the hospital to help with that sustainability and ongoing funding for the hospital.
Okay, so I'll just add up briefly to what Linda said. So we've actually produced the water that we use and supply for the hospital within the hospital. So we're able to get, I think, about 4 deep dark wells, and we're going through there's a hospital treatment setup, reverse osmosis, such that all the water that we use, we drink in the whole area in the hospital is actually produced from here, so that it makes it easier to always have constant supply of water in the hospital, because that's a big deal when it comes to infection control. And then, as Linda mentioned, we have an oxygen plant. And so we realized, as I mentioned, from the nearest secondary facility, it's an hour south and 3 hours north. And so if we don't have a regular supply of oxygen, we would have to keep transporting cylinders in and out within these areas. So we actually have an oxygen plant, and it's in twofold. It's been piped to the entire area of the hospital. So every bedside area has an outlet for oxygen. We don't need to carry cylinders in and out. We still have cylinders as a backup as well, just in case. And then we're using it as an opportunity to supply oxygen within this area, so that any other healthcare facility that needs the oxygen, we can actually supply to them. Yes, it comes at a fee, and that actually helps us, in terms of the financial build-up for the hospital. So as Linda said, it is Ghanaian run, and we're doing different things to just keep it afloat, sustainable, and to maintain a certain level of quality, irrespective of the rural area we find ourselves in.
That's brilliant. That's very cool.
It's really cool.
It is really cool. Wow.
I had one more question for Linda specifically, if that's okay, about we did some research, Pam and I, about your interests in infectious disease and antimicrobial stewardship specifically, and you mentioned it earlier, that you're trying to implement a program here in this setting. Are you able to speak more on that for viewers who might not know what that is, what that means?
Yeah, absolutely. As Amanda knows, I could talk for hours about it. So I will rein it in. I will keep it short.
Yeah.
I was extremely excited when Amanda told me last year one of the priorities that the leadership of the hospital had identified for the next our next mission and our next partnership was antimicrobial stewardship. So for those that don't know, antimicrobial resistance is, of course, a global issue, but it has different implications in different parts of the world. And the global burden of disease due to infectious diseases is highest in Western Sub-Saharan Africa, which is where Ghana is. And so this is the place that has a very urgent and critical need for efforts to improve antimicrobial use, to impact antimicrobial resistance. The country also has a national action plan on approaching antimicrobial resistance, and one of their pillars is antimicrobial stewardship. And there will, over the next several years, be projects put in place by the national group working on this to increase the implementation of stewardship programs across hospitals in Ghana. But this hospital has an advantage of being on the leading edge of that, because it's brand new, only opened its doors less than a year ago. Let's get this into the culture of this hospital now that they're going to use antibiotics wisely. Just in case nobody knows, yesterday was the beginning of World Antimicrobial Awareness Week. It's a WHO global initiative to address antimicrobial resistance worldwide. So this is perfect timing. So in our launch on Friday, we were so privileged that we not only had the ability to speak ourselves about what this would mean to this hospital. We have connected with a pharmacist in the field of antimicrobial stewardship in the closest city, and that's university-based person, as well as a professor and a physician who are nationally part of the action plan on antimicrobial resistance and stewardship in Ghana. So this is an exciting, really important initiative for this hospital, and I think that we've started the momentum. We've lit the fire, right, Amanda? We've lit the fire.
Yes.
And our job for the next year is to get things really up and running and again sustain it.
Excellent. That's very, very cool. Thank you for sharing. And that definitely was brief. You know, you say you were talking for hours. That's hilarious. Thank you. That's wonderful. That was kind of the last question we were going to chat about was, you know, long-term goals and any other, you know, projects you're looking to the future for. So that's a great area of focus. And then maybe a little positive question was, are there any moments of success or, you know, happy stories you are willing to share? You know, days where you really felt inspired and proud of the work you've been doing. You've shared a lot, but if there's anything that comes to mind specifically that you'd like to share.
Amanda, do you have a moment that comes to mind where you feel like we've had like one of those aha light bulb moments? I mean, I think one of the things that I always find when we come here and partner and are working alongside is that everybody works so well together, but like any place, there's still a little bit of silo. And we have great, you know, opportunities when we're here to find ripple effects and try and make sure that everything is connected. So when we are able to get someone to see that light bulb that goes off and like, oh, absolutely, we need to talk to pharmacy about that. Or, you know, I talked to the laboratory technician in the office next door who's running cultures and doing lab work. It's like, you know, aha moments for them. Oh yeah, I should come talk to pharmacy. So I don't have a specific happy story to tell about this, but maybe Amanda, you can help me out with this jumped out at you, because to me every day is a great day here.
Oh, that's great. That's nice.
Yes. I think that we can't speak to a specific happy story, but I'll say that the entire journey has actually been a happy story. From the time that we started working virtually till when I met Linda, probably a year after, it was a very happy moment for me to actually put a face to the person I've been speaking to virtually. And in addition to that, as she said, the collaborative role and the ripple effects that not only pharmacy has, but in every unit, and how it binds all of us together to work, driven by the passion to actually provide quality healthcare for people who really need it but may not be able to afford it easily, actually gives us a thrill. And for us to see this continuing month on month is actually a delight. And I think that in addition to that, we want to go from the norm and the routine in Ghana where patients are not given the best or they're not pampered as much as they should be. We've learned from our partners and we're implementing it that everybody deserves the best irrespective of who they are and how much they can pay. And so service is actually one of the key things that gives us the thrill. Unlike most hospitals, pharmacy does a lot of the drug deliveries. We move from the pharmacy units into the wards. The nurses don't have to come back and forth for medication. The patient's relatives don't have to come back and forth for medication. And so I say that every day, it's a thrill to actually get the opportunity to serve people and know that it is your little contribution to making them feel significantly better over a period of time. So those are my joys, and I believe Linda shares them with me as well.
I do like to just to think about those little things. And one of the questions you had posed earlier, Victoria, that we didn't really talk about is what kind of impact has this project collaboration had on the community? And I'm wondering if Amanda wanted to just, you know, give sort of the perspective of the hospital now that it's up and running, what this meant to the community.
So for me, I would say that proximity to quality healthcare. I mean, you don't have to think too far. You don't have to bother about how you're going to get healthcare. You just know that there's one within your area, a few meters away. You can just walk there or just take a bicycle and ride there. So I'll say that for years, people have learned to endure the pain that they have. They try and bury everything in and keep going one day at a time until it gets to a point where they just can't take it anymore and it becomes a medical emergency. But now we don't have to wait till it's an emergency. We don't have to wait every year for partners to come and have mobile clinics. We can have simple surgeries here. You know, if you need a hernia removal, can be done. If you need a CS because you're having a complex labor, it can be done. If you happen to pass through and all of a sudden your babies are coming earlier than usual, we have the services to provide that, intensive care for babies. You know, so all of these little things were not readily available in some years years ago, let me put it that way. So all of these actually make the people in the community really happy and excited to know that it's for us, it is by one of our own, and we can get the best just like any other person all over Ghana. So I think that the impact on the community is great. And we believe that over a period of time, the general well-being of the community would improve significantly. Yeah, thank you.
And I think that last part is even more important than even the fact that it makes them happy, like that they can get a hernia repair. This is an agricultural society, as Amanda mentioned. Because of a hernia, then his family doesn't survive. So if we can bring somebody back to health, then we rise up the whole community that they can support itself. And then the whole community becomes much more healthy, much more economically viable as well. So you can start to see the ripple of that effect.
Yeah, absolutely.
Yeah.
Wow, that's brilliant. Thank you both for sharing. You know, it is very inspiring to see such a project fueled by, you know, equity and compassion, and it's really wonderful to hear from people in the pharmacy department specifically about that work. Pamela, is there anything you wanted to add from our question list, or any thoughts you had?
No, it's been such an honor to just hear the work you guys have done. It's so inspirational. Every single aspect that you've mentioned has just sounded like such a success to me. To be able to provide such great healthcare to a rural community, it's incredible.
I just have one more thing to add in terms of some of our long-term plans. I mentioned to Linda that it will be nice if we have what you call a bulk compounding space, where some of the medications can actually be produced here. It will cut down our cost in terms of transport, delivery, orders all across, and we can make the simple basic ones that are regularly used here and make it accessible not only to us, but to the community at large. So we're working on that.
Yeah, we're going to take over part of the laundry.
Yeah, and if that doesn't finish, we'll just ask for a bigger space and get a whole block for ourselves.
Love it.
You know, but right now, outpatient pharmacy and inpatient pharmacy share the same space. And so one of our long-term, I would say it's in the 3 to 5 year, Amanda, maybe, goals is to the outpatient pharmacy to an independent site, closer to where the outpatient clinics are and closer to the emergency department, so that it can serve people from the road, but also to take the flow of outpatients away from the inpatient space, and also provide that service close to the emergency for people that aren't, you know, admitted to hospital. They can get their prescription on the way out of the compound. So it's it would also, I think, improve the sort of the flow of inpatients as well, to have it separate. So did you want to see a little bit of the hospital?
Definitely.
We would love to. Anything you can share. Yeah, we'd love to see it.
So Linda, where do we start from? The pharmacy?
Yeah, I'm going to go on mute and I'm going to let you show us what you are comfortable showing and to share with our Canadian colleagues.
Okay, so we'll show you bits of the pharmacy. Yeah. Yes, so we have shelving units that have routine outpatient medications there, and then the patients come through here. Okay, so we have a window where they come through, they give us their identification card. We use the electronic medical record to actually check on them. And then once the necessary requirements are done, we package medication and then we dispense. So we use from one end to the other. Okay, and then we have a larger storage area here where we keep the medication as well. So we do most of the inpatient pre-packaging of the medication here. So you can see we have a very busy workbench. Yeah.
It's there.
It's there. And the medications are here. So the medications we store here, we pick from the pharmacy store, which is way at the other side of the hospital. So we're able to put what we need for about a week or more here, and then we supply it to the outpatient unit. We have a few other units within the hospital. There's an emergency pharmacy, there's a maternity pharmacy,
as well.
We would call those satellites.
So they are satellites, exactly. It just helps us get medications to the respective blocks faster and quicker. When we show you the outside, you understand that the blocks are quite a walking distance apart from each other. And we're doing this so that patients get the ease of flow as they come in. They don't have to walk around too much. Yeah, my fridge.
Bridge, Amanda. Okay.
Okay, so we can go on now.
Mhm.
Okay. So we're exiting the pharmacy. So this is the waiting area for the lab and the pharmacy. So this is how it looks from the outside. Yeah, so the TV screen, we use it for patient education. So we have videos that play on hand washing and hygiene, basic conditions, outbreaks that are there, what to look out for, how to take medications. And then we generally talk about the initiative for the hospital and what we want to achieve, some of the founding fathers and how all of this things together. So, yes, so that is my pharmacy block with diagnostics. And that is the admin block. And this is what Linda was talking about. Each of the areas are linked with this canopy-like walkway. So this is the main entrance. There's a block there that has the registry. The outpatient block is the first one there. So that's where we have the consulting areas, the doctors sit, and then it follows through with the eye clinic and the dental units, all in that block. And then we have the emergency block next to it. It has a fully set up ER with a satellite pharmacy in there. Then next to that block is the surgical block. So we have 4 theaters in there. Then we have a sterilization unit, pre-op, post-op, and ICU as well. Then the last block on that end is the maternity block. So we're walking towards it. The blocks face each other. This is the pharmacy block. Then this is our inpatient one. So we have 2 inpatient units, and patients are housed there when they are on admission. Inpatient 1, inpatient 2. Then we have physiotherapy as well on the other end. Yeah. So that's basically an overview. We have a cafeteria, which is at the other end of the pharmacy block, just so that there's supply of food for both patients and relatives. Yeah, so that's a brief overview.
Let's walk out to the road and show them looking back at it.
Oh, okay.
Look how beautiful this is.
Oh yeah, we can go this way and then show this.
Yeah. Yeah.
Just step down there.
Mhm. We're going to walk out and show you what the front of the hospital kind of looks like so you can get a sense of driving into it. Over there are the staff residences. The fountain's not on today.
Oh yeah, the fountain is not on today.
There's a fountain with fish. With fish in it. Seriously, fish. There's the,
Yeah, so
you
that's
see the front of an administration block.
Yeah.
Yeah. And then on the other side, the same wing, except it's outpatients.
Mhm.
I don't know, does that give you any sense of what this magnitude of this place is?
Yeah, it's wild.
really
It's so
is.
large.
It is a very
impressive.
huge institution. It really is larger than I imagined it would be.
Yeah, and it's all one floor, except for the big administration block. It's the only building that has 2 floors.
Yeah.
But otherwise, it's all one floor, and it's these beautiful canopied walks with these amazing gardens.
Yeah, thank you so much for sharing that with us. It really puts into context, I guess, all the great work you both have been doing.
Aw.
This is an amazing partnership, and
Yeah.
and I hope other people are so lucky in their partnerships that they find when they go out to, seek a way to help outside of your own community. When you push yourself and you kind of stretch. I hope that everybody else has such a wonderful opportunity that I've been really, really lucky to have landed myself in.
It's been, again, like I said, just so surreal to hear all the great work both of you have been doing and all of those great successes.
We hope it inspires others to do good. Yes.
Yes, absolutely. I think it will. Thank you both so much. It was really, really
Okay.
wonderful. Nice to meet you both too.
Nice to meet both of you as well, too.